Welcome to Profound Knowledge.
Let's go through the classification of the drugs used to treat peptic ulcer. If we imagine that the aggravation of the disease occurs in 4 steps, we can easily classify the drugs into 4 different classes. That is, first thing is usually ulcer is occurring because of the aggravation or increase in the aggressive factors like gastric acid. So let us see that the drugs that are going to inhibit the gastric acid secretion. So the very first class of drugs are gastric acid secretion inhibiting agents. The next thing is, for example, there is already excess of gastric acid secreted and then there is excess of acidity already present inside the stomach. So we need to use agents that will neutralize the already present gastric acids, where comes the antacids into action. The next step is, if there is already excess of gastric acid present, that will form the ulcers already. So excess of ulceration will be there. So already formed ulcers are already present in the stomach, and in this step the disease can be stopped by using ulcer protective agents. They are called as ulcer protective agents. And then further, if the disease worsens still by the presence of this Helicobacter pylori, which is a gram-negative organism, which will cause inflammation of the inner layers of the stomach along with the ulcer present, that can be treated by using anti-Helicobacter pylori drugs. Those are mostly antibiotics. So agents that are reducing the gastric acid secretion, agents that are neutralizing the gastric acid which is already formed in the stomach, and agents that are protecting the ulcers which are already present, and then agents that are inhibiting the Helicobacter pylori from aggravating the situation. So these are the 4 different classes of drugs that can help us treat the peptic ulcer. Let us go through in detail what are the different subclasses that are present in the gastric acid secretion reducing agents. So we know, we have already seen that there is a parietal cell inside the stomach. There are cells called as parietal cells that are secreting the gastric acid with the help of proton pump, or also called as H plus K plus ATPase, that will be secreting the H plus ions and then they react with the chloride ions to form hydrochloric acid in the stomach, that is helpful for the digestion. Now these parietal cells are having different receptors over them that help the different secretagogues like acetylcholine, like gastrin, and then histamine to act on the receptors and then further alter the secretion of the gastric acid. So we know that histamine and then acetylcholine and gastrin increase the gastric acid secretion, whereas prostaglandins with the help of EP3 receptors, they suppress the gastric acid secretion. So all of them are having receptors over the parietal cell. With the help of the receptors, they are going to control the gastric acid secretion. So drugs that are acting on this different receptors or on the proton pump itself are under this first category. So there are 4 different subclasses of drugs in the first class. So first thing is antihistaminics. Antihistaminics like cimetidine, ranitidine, famotidine, roxetidine and loxetidine. Cimetidine is considered as the prototype of drug. So we know that when we are eating food, that will go and stimulate the brain, and in that the vagus nerve gets stimulated. There will be release of acetylcholine which further acts on the muscarinic 1 receptors that are present at the preganglionic level, and then which will be further again releasing acetylcholine that goes and acts on the histaminocytes which are having muscarinic receptors over their surface, and the histaminocyte gets stimulated and releases the histamine. Further, this histamine comes and acts on the H2 receptors that are present over the parietal cells to stimulate the proton release, and then from the proton pump, H plus will be released that will react with the Cl minus to form hydrochloric acid. So antihistaminics will bind to the H2 receptors and they will inhibit the H2 receptor and they inhibit the gastric acid secretion. Next one is proton pump inhibitors. These are omeprazole, S-omeprazole, pantoprazole, lansoprazole, rabeprazole and dexarabeprazole. Omeprazole, S-omeprazole, rabeprazole and dexarabeprazole. They sound similar. And then these proton pump inhibitors, they directly go and inhibit the proton pump or H plus K plus ATPase and they directly inhibit the secretion of the gastric acid. And next class of drugs are prostaglandin analogs. Misoprostol. Misoprostol is prostaglandin E1 analog that will be acting on the EP3 receptors and that will inhibit the secretion of the protons from the proton pump. And you have anticholinergic drugs like pyrazinamide, propantholin, oxyphenonium. Pyrazinamide is M1 selective drugs. We can see like anticholinergics have different sites to act. There are receptors like M1 receptors, M3 receptors and only muscarinic receptors directly present on the histamine site. All these receptors can be inhibited by the anticholinergic drugs. Pyrazinamide is M1 selective drug. It acts on the M1 receptors at the preganglionic level and then it will inhibit the secretion of the histamine also. So here one thing that can be noted is antihistaminics will inhibit the gastrin related as well as food related and acetylcholine related stimulation of the gastric acid secretion. And anticholinergics can inhibit the secretion of gastric acid by the histaminocytes also. So because they go and they stimulate the histaminocyte and they increase the histamine secretion, further causing the stimulation of the proton pump and releasing the protons. So anticholinergics also inhibit the histamine release and they inhibit the gastric acid secretion by the histamine. So that is about the 4 different subclasses that are present under the gastric acid secretion reducing agents. Now the second thing is already present excess of gastric acid can be neutralized by using antacids. The name itself is telling that they are antacids or basic agents. 2 subclasses of them are systemic and non-systemic. Systemic agents are going to enter into the blood and then they inhibit the acidity in the stomach. Examples are sodium bicarbonate and sodium citrate. You can go through all the names. All of them are basic in nature, systemic as well as non-systemic. And non-systemic are not going to be solubilized and they will not enter into the blood circulation. They cause topical action inside the stomach and they inhibit the gastric acidity. Examples are magnesium compounds like magnesium hydroxide, magnesium trisilicate and aluminum hydroxide gel, calcium carbonate and magaldrate. So these are all basic agents coming under the category of antacids. Next one is ulcer protective agents. They sucralfate and colloidal bismuth subcitrate. They are going to coat the ulcers that are present in the stomach and then they inhibit the aggravation of the ulcer and they are going to protect the ulcers from getting aggravated. Next thing is drugs that are inhibiting the excess aggravation of the disease by Helicobacter pylori. So anti-Helicobacter pylori drugs. These are all basically antibiotics. You can see like first thing is penicillin, that is amoxicillin, second one is tetracycline and the third one is macrolide antibiotic clarithromycin. Then you have metronidazole and tinidazole. These are antiprotozoal agents. So all these are different antibiotics. We can see like the antacids are used in combinations and Helicobacter pylori drugs or these antibiotics are used in combination with proton pump inhibitors to curb the ulcer aggravation.